If you have questions during Susan's presentation, please enter them in the chat, and then Viv is going to keep her eye on it, and she'll bring those to Susan's attention, as we go along. As I mentioned, we are recording the presentation. You're not required to keep your video on if you don't want to, but please do keep your microphone muted during the course of the presentation. If there are students here for FYE credit or extra credit in class, please enter your name in the chat along with either FYE or the name of the course that you're getting that extra credit in, so we can be sure that that gets back to the right people. And if there are any community members here, folks who are who do not work or go to school at the Mount and don't already get emails from us about our events, and if you'd like to hear about future events hosted by Mount St. Mary College, please put your email in the chat and we'll make sure that you get future notices. Thanks again for being with us. We really appreciate you taking this time. And now I'm going to turn this over to Evan to introduce our special guest today.
Thanks, Barbara. Really happy to introduce Dr. LaRocco. So as many of you, most of you probably know, she's the Dean of the School of Nursing here at the Mount. She has a BS degree from Boston College, an MS in Nursing Administration from Boston University, and an MBA from NYU. She earned her PhD at UMass Boston, and her major research interest, which is very relevant for this talk, is male nurses, particularly when it comes to the recruitment and retention of men in nursing. The talk that she's going to give today is part of a larger oral history project that is focused on men who graduated from the Alexian Brothers Hospital School of Nursing. And she actually has presented this lecture, which is based on research funded by the Karen and Terrence Holm Visiting Scholar Award at the Midwest Nursing Archives of Chicago. So I'd like you all to join me in welcoming Dr. LaRocco.
Thanks, Evan. Thanks, Barbara, Vivian. It's my pleasure always to talk about what I refer to as my guys, the men who were part of a very unique experience in nursing, in that they were in an all-male nursing school in an all-male hospital. So how do they get to do obstetrical nursing? Well, first of all, let me tell you a little bit about the purpose of the research. It's just to explore the experiences that these men have had. And as Evan says, it is part of a larger project. I've presented at a number of different locations about their finding the program, their interest in the program, their experiences in school, but the issues around obstetrical nursing were particularly unique. So I had the opportunity with this grant to use the Alexian Brothers Provincial Archives in Illinois, the Midwest Nursing History Research Center, which is in the College of Nursing at the University of Illinois in Chicago, and to view a vast array of documents. In addition to that, I have had the opportunity to interview about 22 Alexian Brother graduates over the years, and they've told me many, many stories about their experiences, their careers, and so this is one small piece of it. So one of the things I think is important when we consider history is to think about the social and cultural norms of the time. So we're thinking back to the 1950s here primarily, and also about issues of gender and gender equality. In nursing, we think differently, in part because most nurses are women. So where other fields talk about women being made into a minority, they're not as able to speak, they hit glass ceilings. It's a little bit flipped with nursing. So at the time that all of this took place, male nurses were not more than about 2% of all nurses. And here's the quiz. What percent do you think they are today? It's actually about 12% now. So that's still a pretty small number. They're noticeable. We notice them in our classes, certainly, because there's one here and one there compared to all the women in the class. So, but let me tell you a little bit about the Alexian Brothers first. a monastic order, obviously by the name. Their focus was always on the people with diseases, the insane, the rejected poor. They were particularly active during times of plague when no one else wanted to get near the patients at all. They started in Germany. They expanded throughout Germany into Belgium. And then in 1866, they had their first American congregation in Chicago. Immediately on arriving here, they did start a hospital, 8 beds in a little wooden house in Chicago. Few years later, that's one thing I've always seen about the Alexians. They don't drag their feet. They move on. If they're going to do something, they're going to do it with a lot of action. So their second hospital was 70 beds, only 2 years after starting an 8-bed hospital. It was an all-male hospital until 1962. In 1966, they started a brand new building, St. Alexia's Hospital, they called it, out in Oak Grove Village. One of the men I interviewed told me when he and some of the other students drove out to see where it was, they couldn't imagine why anybody would be building a hospital out there in the middle of the cornfields. But as usually, the Alexian Brothers were looking to the future, and it was an area that developed very quickly. And in 1968, they closed their Chicago hospital. It was a building that was deteriorating, the neighborhoods were changing, and it wasn't feasible for them to stay there anymore. So what about the nursing school, though? They started with an annual series of 24 lectures, 2 hours of physician. And then by 1898, again, you notice the rapid changes they made. They incorporated as the Alexian Brothers Hospital School of Nursing. It was the 5th all-male school in the US, and most people aren't aware that there were any all-male schools. And it was a 2-year program. By 1932, there was beginning to be a lot of regulation around nursing and nursing schools. So they were the second nursing school to be certified by the state to actually receive that state approval as certification. In 1952, the National League for Nursing started doing accreditations, and they were accredited at that time. 1966, the brothers decided that they couldn't continue the school. It lasted 3 more years. At that time, classes stayed for 3 years. It was a 3-year program, and their last class graduated in 1969 with 21 nurses in it. In the entire program, the entire time they were incorporated as a school, there were 779 men graduated. And I say that it was in the entire time only men. Some of the time it was only brothers that were allowed to enter. Other times they had non-religious men. Most of it was with non-religious men. When they had religious men, they came from a variety of orders. So there were Alexian Brothers, but other orders also sent people to their school. And this is a picture of one of their classes. So it's very unusual to see a class of nursing students that looks quite like this. So what about obstetrics? Well, the Alexian Brothers had clinical affiliations. In their report in 1956, I believe it was, no, yes, 1956, they mentioned in their annual report that all their affiliations remained unchanged from the previous year. They had psychiatry, they had pediatrics, and it was in different locations for the lay and the religious students. No one I've talked to has ever really explained why that was in different locations. And I have interviewed the person who was the director of the school during that time, but he said, I really don't know why we sent them in different places. They also did a tuberculosis rotation. That was pretty common back at that time. And then they had other clinical experiences that were at their home hospital, the Alexian Brothers, urology, surgery, orthopedics. The Alexian Brothers Hospital really specialized in a lot of workman's comp cases. They were kind of the go-to place for firemen, policemen, things like that. And being an all-male hospital, there was a comfortable level of interaction there. Male nurses, male nursing students. It was a very unusual place. At that time, what we now call the NCLEX existed as state boards. So this was the way you received your licensure. And some of my colleagues who are a little more like my age remember this. We had 5 sections. It took 2 days. It was a paper and pencil. You had medical, surgical, psychiatric, pediatric, and obstetric. The men at that time were not required to take the obstetrics portion, and they had a substitute. They took a urological portion of the exam to finish and then received their license. So at that point, male nurses were different than female nurses in terms of not the license they received, but how they got that. But then things started to change. In 1956, at one of the advisory board meetings, the minutes read, recently one of our graduates was denied reciprocity in the state of Michigan for a lack of obstetrical nursing experience. So many of the men went to school here at the Alexians in Illinois, but they were from all over in the Midwest, and they often went to another state to practice. Reciprocity meant that you applied to the state you wanted to practice in. You provided the evidence that you had taken the exam and gotten your license in the first state, and you got reciprocity. You just paid a fee. Except now it wasn't happening because Michigan had decided that every nurse needed to take obstetrics. And because these men hadn't had it, they weren't able to get a license. So the advisory board was told that the Hospital School of Nursing was doing a survey to determine the needs for an obstetric affiliation. Unfortunately, with all the things I looked at, I never could find that survey. We find the results of it, but we don't really see the survey ever. So Brother Morris was the head of the school, and this is a special meeting of the faculty organization. And I can just see the scenario. Here's all the faculty, male nurses, gathered around. Now, Brother Morris has been investigating the problem. He's done a survey, and here he is. He announces at this meeting that there's an affiliation of 8 weeks in obstetrics at Mercy Hospital, and it's been approved by the nurse board examiners, Board of Nurse Examiners. So I can envision this, seeing our faculty meeting, seeing the consternation on the men's faces with suddenly things are changing. And sometimes they're changing so fast, they're not quite sure that they can understand this. Well, what do you mean our men are going to do obstetrics? Well, Brother Morris had a little bit of a problem because here he was with his all-male hospital and all of his male students that are suddenly going to have to find a placement. We all know how hard placements are. Well, he had good connections, always important in nursing, and so he described it in the interview with me. We were lucky because we had Sister Annette of the Mercy Sisters, who really took this as a challenge to help the brothers establish the OB clinical experience. We anticipated all kinds of problems when we would send the students to OB because it was a new experience for us. They just weren't sure how this was going to all come off. Over the years, they used a variety of sites. And again, it's a little bit sketchy as to why they chose some sites and why they chose others. But let's take a step back. The curriculum plan dated September 1st, 1956, indicated that the students did receive experience in didactic in obstetrics. They were taught obstetrics. They just never had the chance to practice it, nor did they have an exam in it. So the 1954 to 56 College Bulletin, School of Nursing Bulletin lists the faculty. It includes a Mary Adelaide Burchardi, RN-BS. She was the instructor in obstetric nursing. It was a third-year course, third semester course of 45 hours. So there's also a footnote that says it was required for all lay students. It's not clear if the male religious students actually ever took the didactic portion. And so we see kind of a hodgepodge of who's doing what and how it's all falling out. So by the 1958, 1960 bulletin, obstetric nursing was now listed as a 60 clinical day experience. And it was listed as 80 hours in the second or third semester of the second year. And there was a little footnote, 80 hours, quote, includes clinical instruction hours. So in that 60 days, it seems that they only had 80 hours of actual either didactic or experience in the hospital. So, but they did. So some of the students' perspectives, and again, these some come from written contemporary things, and some of it comes from my interviews with people. So the Almanar was their school newspaper. And so by November of 1956, this had filtered down to the students, saying that this was going to be the new way to do things. And in a column there, one of the students wrote, "We are happy to have this new experience to look forward to, since it will undoubtedly round out the entire curriculum." I look at this and I think, really, were they happy? Or were they terrified that suddenly they were going to go to maternity nursing? Remember, these men ranged from about 18 to 20 or 21 years old when they started school. Some came directly to the school from high school. Some had been medics in the military and then found the school after that. But I really, and I'm looking at video here thinking, really, do these videos, our OB professor, really, did these young men look at this new experience with all this excitement that they're pretending in their written work? So by February 1957, the experience is beginning. In the delivery room, the students scrub for deliveries or circulate, whichever is necessary. Let's put this in context. In 1957, many women received anesthesia, a lot of anesthesia when they had babies. It wasn't the time of natural childbirth. Men were relegated to a waiting room. They certainly were not in the delivery room at that time, husbands, fathers, not like today where you bring the whole family into delivery rooms. Also, they take blood pressures of women in active labor, fetal heart tones, and any other procedures as the need arises. Rather vague, but the fact that they were in the delivery room is important. So they were given the opportunity. So in the Diaconium in 1957, that's the college yearbook, the School of Nursing yearbook, there was great joy and gratitude when we were told that the proposed obstetrics affiliation was no longer a dream, but a reality. It is the realization of desires of past classes and hopes of future classes, coupled with need and perseverance. Sister Annette has planned the educational program so that in addition to the experience in the nursery and the formula laboratory at Mercy Hospital, the student also receives experience in the delivery room and the outpatient clinics at Lewis Memorial Hospital. The fact that many of the women would have had enough anesthesia that they wouldn't even know who was in the room was something that many of the men spoke about. So here we were, now to 1961, the advisory board, once again, here's Brother Morris, he's discussing the problems of the obstetric experience for the religious. So here, they hadn't yet really started to do the religious experience. It has to be worked out. They need to make some arrangements. Why were the religious excluded? At first, it was because the cardinal would not give permission for religious to do this. So here we're seeing some tension between the hierarchy of the church, the Alexian Brothers, the generosity of a sister who has a important position in a hospital, which probably also had its own nursing students there, all female students, and then throw in the tension of the times. How many men at that time were comfortable with the idea even of a male nurse, but certainly a male nurse caring for their wife at the time of delivery or prior to delivery. So a lot of things going on here. So then the faculty later in 1961 recommended that they, the religious brothers, be permitted to receive the experience for the following reasons. And those reasons being to be eligible for licensure and to be better prepared for the state board exam. Because now the men had to take the obstetrics portion, and clinical often helps people understand the things that they've learned in the didactic session. So here we are with now the religious being involved. So effective immediately, the brothers would be allowed to take obstetrics theory and practice. And this was now a rector general who made this decision. But there were still some caveats. Each religious brother had to have the approval of their own community. So because they had brothers from many communities, they had to make sure that each community was happy with this plan. So here's two of the obstetric instructors' pictures that were in the yearbook. The students speak of them in a variety of settings, but let's talk about their personal experiences now with this. So Jack was in the class of 1958, and he told me that we were like doctors. So, and I think there was a real intention there. After all, nobody thought it was right for a man to be a nurse. So let's pretend they're doctors. They were treated like interns. And they often got to do things that the female nursing students didn't get to do because they were being treated like the sort of subservient women who were nurses. This was definitely a dilemma for many, many people that were interacting with the men who are nurses. So, and yet Jack says they had the highest, best regard for us because we come from Alexian Brothers. So, and these were both Catholic hospitals too. So we got along real well. That was really good. So I think some of the older nurses, from what the stories I've heard, the nurses who had worked obstetrics for a long time were a little uncomfortable, or maybe a lot uncomfortable, with this sudden group of men that were in their territory, kind of the female turf of the nursing profession. But the young female nursing students didn't think it was all that bad at all to have all these young male nursing students around too. But that's a little bit of another story about some of the parties that were had at the Alexian Brothers Hospital School of Nursing when they invited the other local schools. So another student from the same class, he says, I liked the delivery room because there was anesthesia involved and I'd never seen a birth before. It was quite interesting. Joe went on to become a nurse anesthetist. So he was very interested in what we would call the head of the table, the giving of the anesthesia, as opposed to as interested in what was happening at the foot of the table where the baby was. He goes on though, he said, we were treated quite well. There was never any animosity or remarks made or anything like that. They were all very helpful. They, meaning the husbands, thought everybody was a doctor, that all men were doctors and all women were nurses. And I think there was always a little bit of a intentional misleading. There was no rush to say, oh, by the way, I'm a nurse. The next class, though, Roger, the class of 1959, I don't remember Mercy very much. They didn't allow us to do much over there. It was kind of an orientation thing. So a lot depended on who was in charge and the experience of the different hospitals. But he goes on, now Lewis was a little different. It was mostly charity. So as soon as you see that era, you're looking at, there were private hospitals, there were people who were the paying hospital customers who got certain levels of care. And then there were charity hospitals where things were done quite differently. So it was mostly charity. Deliveries, he says, I participated in deliveries, did a circumcision one time. The obstetric surgeon was right there with me, thank goodness, and said, this is how you do a circumcision. And I still remember, he says, I can't believe doing that kind of thing at that age. I was just about 19. I can assure you that that mother was never told that the circumcision was done by a 19-year-old nursing student. Vince from the class of 59, he went to Mercy Hospital. That's where we first began feeling the discrimination against men in nursing was at Mercy, all the females. And I think of all of the areas in nursing, probably obstetrics is one that has always been viewed as sort of the woman's domain, whereas other areas, men nurses have been more accepted, orthopedics, psychiatry, but this was where women were. And so he was one of the few that really described the discrimination. One of the things I thought was unique about most of the men that I interviewed from the Alexians, and I interviewed men from about the class of 56 right through the end class in 69, is they recognized that there were times that they've been discriminated against in their career, but they didn't dwell on it. So some of them who said there wasn't any, I think they just had moved on, because others in that same era or class would describe things that were clear. So anyway, Vince, though, remembered some discrimination. But then as time went on, a relationship developed between the Mercy students and the ABH students. And it got to be very warm, and we really looked out for each other when we were there. So their inroads of acceptance came probably more with the nursing students than with the older nurses who said, this is the way we always did it. How come we're doing it differently now? Patrick was in the class of 1962. He says, we were on eggshells at the OB affiliation because it was the first time. We were the first class of students who went to that private hospital, which was St. Anne's. So again, we see the tension between the private hospitals and how the charity hospitals accepted people. We had a marvelous instructor, very mature, good nurse. I loved it. I really did. I loved obstetrics. Patrick actually loved all of nursing. I have really met someone who so many years later could talk of nursing with such enthusiasm. Wayne said he went to the Chicago Maternity Center. And here at the Chicago Maternity Center, they did home deliveries. So we went out on runs on those, and that means you delivered babies in the homes, which was fantastic. So you were very busy, but it was we had a fantastic clinical instructor. It was a fantastic experience. Wayne also often got carried away with telling me. One of the things I found in doing interviews with men from this school and men from other schools, the few that I have in my group of oral history project, is no one had ever asked them before much about their career. And boy, once they got going, they were amazing. They just couldn't stop telling me about everything. So here's Brother John, and he was in the class of 1966. So they've been doing this now for about 6, 7, 8, 9 years and trying different places. And one thing I never found was why they moved from hospital to hospital. And there was no incident that suddenly you had to leave, but nowhere in the records could I find anything, except they mentioned occasionally, we had to change or something, but never really why. But Brother John at Holy Cross Hospital, we arrived, and then the head nun put us in the utility room, and we sat there and folded old sponges to keep us busy. Clearly, this nun did not want the men there. And we did that for a day or two, and finally went to Brother Morris and said, we are not going to learn anything. So he had to come down and talk to the head sister, the sister in charge of obstetrics, who was not very happy with us, but we had to prove ourselves. She then allowed us on the OB floor, delivery room, postpartum recovery room. So they had to advocate for themselves, because they were going to sit for their entire rotation in some little utility room folding sponges or something. But they went back, and Brother Morris was a great advocate for the men. And this, I thought, was amazing. Brother John also described how we started a program where no baby could be discharged, so we taught the father how to diaper. Now, I can tell you in 1966, most men said, I don't do this. They loved it. They loved it. So I'd go in and say, okay, we're going to diaper the baby. And the father would say, I can't do that, the guy would say. And we'd say, yeah, you can. You can't take the baby home. If I can do it, you can do it. Now, let's do it together. I'm going to teach you. Classic patient and family teaching. A male nurse says, I can show you how to do this. You can't take this baby home till you can do this. I thought it was a great way for them to make themselves a part of this whole obstetrical experience. So by 1958, the first class had to take the obstetrics portion of the state boards so that they would be able to be eligible for reciprocity. And in that first exam, there were 27 graduates that year, 26 passed, a pass rate that we would be happy with, 96.3%. Now we're speaking only of the obstetrics portion. The exam is not given in sections anymore. Passing grade was 350 points. And in that group of 27, the 26 who passed, 13 scored above 450, 2 scored in the 700s. And I believe 750, some of my colleagues might remember this, I believe 750 was the highest score you could get. So overall, they did quite well. The next year, there were 30 that took the exams. One was a brother who was a graduate that year. The brothers were still not going to maternity. They were taking urology portion. And here they had 28 of the 30 pass, and 16 of those scored over 450. At that time, and I come from the era when we took our state boards in the 5 sections like that, but certainly people that were scoring in the 450s were considered, they did really well. So your score at that time came to you on a small piece of paper. I still have mine. And it gave you a score for each individual part. And if you failed one part, you only had to retake that part. So these men who failed, the one in the 1958 class and the one in the 1959 class, the two of them in that class, they would have had to retake that portion. I did not find any records that showed whether they passed it on the second try or not. And so just to reiterate some of my sources that I mentioned earlier, and then a lot of secondary sources, books and articles about men in nursing and what nursing education was like at that time. And so that's my story. I'm happy to answer any questions. Thank you, Mary. Lydia. I only can see you all on the small screen, so I don't see all who's here.
Susan, what prompted you to query this topic?
When I was looking for a dissertation topic, I had decided on one, done tons of things towards it, and then changed because I was teaching in a community college and we had a fair number of men in it. And so often men go into nursing at a little bit older age. And so I was intrigued because the older we educate a person at, the less years we get out of that education as practicing nurses. And so I started looking at why men, boys, high school boys don't see nursing as an option, and what were the things that caused men to change their mind and want to go to nursing. And then when I joined the American Association for Men in Nursing, the president at that time was from the Alexian Brothers School of Nursing. And he started telling me about it. And I was just intrigued with the idea of an all-male school. And so he gave me access to alumni lists. He invited me to a reunion where I got a chance to meet some of the men. And then during sabbatical, you know how good sabbaticals are, Anne Marie. During sabbatical, my husband and I traveled throughout the Midwest for about 6 weeks and interviewed men from the Alexian Brothers. So they're still my guys.
Yeah. That's great.
Susan, had you ever done oral history project like this before?
I had started before I knew Jean with interviewing men from any school of nursing. So I have about 5 or 6 interviews that were from, you know, the one man in a school. I actually went looking for the one man who was in my class in a diploma program and found that he had died. But once I met the Alexians, their whole life story was so different because of the all male. They never felt marginalized while they were students. And so as a result, they were very strong when they became nurses, but then their careers were interesting. A lot of them went into anesthesia. And in part, that was because nursing salaries at that time were so low, no man could support a family on it, whereas anesthesia opened the doors. And anesthesia programs at that time were hospital-based. They started at a year and a half, then they became 2 years. But one of the interesting stories, the man who was in an anesthesia program in the upper Midwest, I want to say Michigan, but I wouldn't swear to that. He was in the anesthesia program. There were 3 students started that year, 2 women and him. And then he needed to supplement the little stipend they gave him. And he went to the hospital he was training anesthesia at, to get a job. And they said, oh no, we don't hire men for nursing. And there were a number of them that had those kind of incidents. They were flat out told, we don't hire male nurses. It's as simple as that. We don't. So it was interesting to see how those dynamics, the other dynamics that I thought were interesting were in the operating room. In that era, the operating room, the surgeon was not only the captain of the ship, but the god and, you know, everything that you bowed down to in surgery. There was bad behavior sometimes, things like, you know, throwing an instrument at a nurse who was too stupid to give the right instrument. That did not happen at the Alexian Brothers. And I heard that from a lot of different people, because the brothers said to a surgeon who wanted to act that way, never again. You will not have privileges here. And so you had the males in charge of the hospital, you had the male students, you had the male doctors. There was no nonsense. Nobody was going to be God there. They were going to work together. So it was pretty interesting.
Was
And
there
when I
any
retire, I'm
indication,
going to have time to spend more time with my guys again.
was there any indication that you found of how many retiring firemen, policemen, and military medics subscribe to going into a nursing program?
That was common, I would say more into the 80s or so, but back in the time when this school was open, medics, but they would have been like a one term in the military type medics. They were 20 years old, 21, 22 years old, and they would find the Alexian Brothers as a place to go. But one of the 1969 graduates had an interesting experience in that he was supposed to be, I think, about a 1966 graduate, but he was the class president and they had a pretty wild party at the Student Nurses Association meeting in
Oh.
Chicago, and he got kicked out of school.
Oh,
But
wow.
But he got kicked out of school at a time with the draft had made him exempt. So he then wound up being drafted, and he got to be a medic, I think. And then one of the brothers kind of appealed to Brother Morris to get him back in to finish up the last year. And he graduated in the last class. But I heard some stories about the State Nurses Association conventions, because this was like all the male students in the whole state came from the Alexian Brothers, really. And they enjoyed the conventions quite a bit, I heard.
I was just thinking that it was possibly after the Korean War, and a lot of the medics that were being discharged might have gone into the nursing programs.
I think some of them may have, but they were all short-termers. They weren't like retired militaries. Yeah. But
I can understand why you would sort of create that bond with the students that you, or the nurses that you spoke with, because I do think that's sort of the nature of oral history, that you get to know the person, and it's very, I guess, seductive in a way. Like you want to do more because it's very rewarding to connect with a person about something. Because generally, when you're doing that, you're talking with them about something that's really meaningful to them. And yes, I could see why you formed this bond with them.
well, one of my favorites was Vince, who was an orphan, and he was brought up in a Catholic orphanage. And as he was about to age out, the coach helped him find something. So he went in and started working as an orderly at the Alexian Brothers. And I interviewed him, and he told me the whole story and how he then was given a scholarship. The day after he told me that story, he lived in Chicago, I went out to the archives. I had already made an appointment to spend my day there. And as I went through things, I found an advisory board minutes that talked about this wonderful young man and how he would be so deserving of a scholarship. And so it was really interesting to see how they had seen this in him. And I think what they did was wanted him to work as an orderly first so they could see the quality of him, and then they gave him the scholarship. But he was just so thrilled of finding the Alexian Brothers and the camaraderie and stuff. And he actually had an interesting experience when they went to one of the Catholic hospitals for OB, in that one of the nuns who had run the orphanage now was working in the hospital and recognized him, and of course called him by the baby name that she knew him as and all. So, he was the liaison between the male nursing students and the hospital now, because Sister so-and-so loved him when he was in the baby room. You're right, I love my oral histories.
Yeah, it's easy to make that connection, I think.
Uh,
Other questions? Is there still such a thing as an all-male hospital?
I am not aware of any at all. And there was only, when I was doing my dissertation, only one school that I found that was technically an all-male nursing school. Believe it or not, that was Simmons College, now called Simmons University in Boston, because it was a female school. And at that time, they only admitted males into their master's programs. And so technically, it was a school that didn't allow men to be in their nursing program.
I just wanted to add that it's interesting that a typically female predominant occupation such as nursing that really represents nurturing and caring could be your particular interest really should illuminate some of the, how do I say, leveling the disparities in the health industry, specifically in nursing, between opportunities for both men and women I would love to see something. This is an example of the necessity of better dialogue and better reciprocity in terms of salaries and opportunities in education. It's very meaningful, and it would be really exciting to see this shared at a national forum on this topic. Has that come to your mind at all?
Well, I've presented about, not from that perspective, but I've presented a number of, both from my dissertation and from the Alexian Oral History Project at history, national and international history meetings, and the Men in Nursing and Sigma and places like that, but not from the perspective of the equality or salary perspectives at all.
Right. Yeah, I guess I was highlighting the internal, what's the word? In the back utility room, those experiences, the experiences that aren't disclosed that most nurses have had, including, sexual abuse, many bad things that rarely get to be illuminated. So I'm only raising that as a segue.
Yeah. I think oral history actually is a way that a lot of that can be illuminated, because it's a very, as Barbara described, kind of an intimate relationship. Once you sit down and they forget the tape recorder is running, although one of the problems that occurs is they tend to move it around sometimes. But they get so engrossed in talking about it, they don't think about the fact that you're recording it, and so they tell you their stories. I'm really looking forward to immersing back into all of this in a few months. So thank you all for coming. I appreciate it.